FADIC offers a variety of international online trainings accredited by FADIC and provided by well-reputed professionals in the field, which means that you can always keep up with the latest topics in your specialty wherever you are and whenever you need it.
بسم الله الرحمن الرحيم والحمد لله والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. أحب أن أشكر أخوي الدكتور فارس وأخي الدكتور فواز على التنسيق اللي حصل في موضوع هذه المحاضرة والمحاضرة القادمة بإذن الله. في بداية الأمر راح أتكلم بشكل تفسيري عن الموضوع إنه الميديكيشن مانجمنت سباحي ستاندردز. راح نتكلم في موضوع إن هذه يخص تجربة المستشفى الملك سعود بعنيزة فيما يخص الاهتمام وإعادة الاهتمام. راح نتكلم عن المعايير، كيفية عملية الامبلمنتيشن، كيفية التحضير والترتيب لعملية التطوير بشكل أو بآخر. أهمية التطبيق المعايير عندي قبل ما أبدأ راح نغطي اليوم يمكن تقريبا 22 معيار. المعيار اللي هو Medication Management 1 اللي هو Patient Specific Informations، هو Medication 2 اللي هو Pharmacy Organization and Leadership، و3 اللي يتكلم عن Staffing وال Scope of Services، و4 اللي هو Compliance with Saudi Law and Regulations، والHighlight Medication Lookalikes and Alike Medications، والPharmacy Therapeutic Committees، والHospital Drug Formulary، والHandling Non-Formulary Drug Requests، والHandling Out of Stock Storage Disaster Needs of Medications، والStorage of the Regular Medications، والStorage of Refrigerators. كل هذه راح نغطيها إن شاء الله لحد المعيار اللي هو رقم 22 اللي هو Antimicrobial Prescribing. بالنسبة قبل ما نبدأ راح أعطيكم بس تعريفات راح تمر علينا خلال المحاضرة. تعريفات راح تكون عن موضوع الستاندرز وهو الأساس في الموضوع، بعدين يجي بعده السب ستاندرد وهو الميجربلز ستاندرد هي كان سكوت. يعني المعيار راح يكون عنده سب ستاندرد أو يسمونها معايير ثانوية، وهذه هي اللي راح يكون لها سكور خلال فترة السيرفي نفسه. عندنا برضه راح تجي كلمة دوكيومنت ريفيو. دوكيومنت ريفيو يعني محتاج من المستشفى أو الصيدلية أن تحضر سياسة بوليسيز أو بلان أو جايد لاين أو بروتوكول. إذا كانت دوكيومنت ايفيدنس اللي هي عملية اللي هي النماذج الخاصة مثلا زي تشيك ليست حقت الكراش كارد، تشيك ليست حقت الريفريجريتورز، الكومبتنسز والاورينتيشنز، هذه كلها دوكيومنت ايفيدنس. اذا تكلمنا عن البيرسونال فايلز معناته هذا المعيار او هذا السب ستاندرد راح يكون عن طريق ملف الموظف نفسه، يعني يحتاج اني اشوفه او السيرفاير راح يكون يشوفه عن طريق ملف الموظف. راح يكون برضه في انترفيو، معناته راح يكون في اسئله موجهه للموظفين سواء في الصيدليه او سواء في الاقسام. وبعض المرات يكون السب ستاندرد يحتاج اوبزرفيشن، راح يكون السيرفاير يشوفه بعينه. اوبزرفيشن ملاحظ. بسم الله الرحمن الرحيم. نبدا الان في عمليه الميديكيشن مانجمنت is an important part of the preventive, curative and palliative treatment of many diseases and conditions that are dealt with by healthcare professionals in the hospital. It aims to eliminate any potential harm that could be caused by medication. Hospital needs to develop their own medication management system that fulfill two important components. Important here if you're looking for the effectiveness and safety. This is two dimensions of a quality. The quality, they have a lot of dimensions. One of them, effectiveness and safety. If you go into the word STEEP, means STEEAP. That means safety, time, effectiveness, efficiency, equitable, and patient centers. One of two dimensions of quality. This chapter is looking for the effectiveness and safety. Effectiveness means we are reaching our goals, and safety, we are doing our practice and safe. The chapter will be covering the staffing plan and the qualifications, staff education, selection and procuring of medications, storage, ordering and preparation and dispensing, administrations, monitoring and evaluations, using evidence-based practice, and also reducing the variation error and misuse, and reporting the medication error. This is as a whole, the chapter will be covering all these things. But we'll go to the standard now. See the first standard here say, patients' specific information is readily accessible to all healthcare professionals involved the medication management system. Here we are looking for what? We are don't looking for the standard itself, looking for the measurable elements, or the substandard means medication management 1.1. في أصوات ترى تطلع عندي في مشكلة عندي ما أدري. The hospital has a multidisciplinary policies and procedures on patient-specific information to be readily accessible to all healthcare professionals. Substandard, they are looking for that some patient-specific information should be readily accessible to all healthcare professionals. Means we have some information should be available to the caregivers when they are dealing with or ordering or prescribing the medication for the patients. And here written multidisciplinary, that means all the caregivers who's involved in the process should be signed in this policy. And this multidisciplinary policy should be also defined or to be clear in the mother policies. Already this is in the QM chapters. That means that we have one policies, multidisciplinary policies. That means nursing is signed there, pharmacist is there, and physician is there, and who's also the need to or ordering the medications and dealing with the information of the medication should be there, and like medical record people and also dietitians and social worker to be involved in this process. See here, document review. That means the certifier, they will be looking for the policies for accessible patient-specific information. Only he will looking for policies, and he will do scoring from 0, 1, and 2 to this substandard. Substandard number 2. In case of emergency situation, this should be mentioned also in the policies, and also during the survey, the certifier, he will asking and he will observe it in case of any emergency. At least some accessible information should be readily available, and this is also it will not be affect the life saving of or saving of the patient life. Medication management 2, the pharmaceutical care department has a clear organizational structure and is directed by a qualified pharmacist. That means he's looking here for organization chart and also for the staff accreditation. See number 1 from 2.1, pharmaceutical clear department has a clear organization structure. Here we are looking for the organization chart of the pharmacy, and here written in the red color here, document evidence. As I told you before, they need check sheet, they need about some competency. Also, organization chart will be document evidence. certifier, he was looking for this organization chart, and this organization chart should be prepared by the pharmacy and signed and reviewed from like medical director and approved by hospital director. They need to what already put it in the pharmacy should be not labeled by name, but what already inside the file of document review should be, or you can put it the name of the person who's like OPD supervisor and ER supervisor and quality coordinator and TPN supervisor or unit dose supervisor, whatever there, you can put the names according to this organization chart in your file. And number 2, the head of pharmaceutical care is licensed pharmacist qualified by education and training. This is very important. Even he will looking here staff interview and personal file review. See very clear here staff interview, that means he will ask and they will see the qualification, education and training of the staff, and also we'll go looking for personal files. They have to comment. They have personal files review time. That means he will looking for the education and training of this head of the pharmacist. Also, he will looking for registration of Saudi Commission for Health. See here, license for registered nurse, for registered pharmacist, qualified pharmacist, education, certified training and experience, registered pharmacist, valid professional registration with Saudi Commission of Health Specialists, MOH license, the Ministry of Health practice license in Saudi Arabia as applicable. And it means in case if not MOH or non-governmental hospital, the pharmacist and the physician, they have some license, should be readily available in the personal files. Also, they were looking for the job description. The job description, they had a written statement that described the duty, responsibility, required qualification, candidate, and reporting relationship. The head of pharmacy has a valid professional registration, as I told you. Should be all the registration available in his personal file. That means this standards, these two substandards, they will review through personal file. Even also the fourth standard, the authority and accountability. This is here. They will be looking for the job description. That means the head of the pharmacy should have registration in Saudi commissions. He has a license. And also he has a clear job descriptions, and he signed for these job descriptions. And also they have assignment letters. He is like he's director of the pharmacy care in the hospital. When he went there to looking for the certifier, looking for his personal files, should be all this document available in his file. Number 3. The pharmaceutical care department has adequate number of qualified staff. Here we are looking for the pharmaceutical care department has adequate number of staff qualified, education, training, and experience. Here we're looking also personal files review and also staff interview. Adequate, that means they have you should have staff plan. Staff planning, staffing should be based on the workload, and they have equations for that, and you have a list, for example, budgeting, number of the staff, and what current you have, and what your plan. That should be prepared by the pharmacy head department and also approved and signed from the HR department in your hospital. This is very important even for this staffing plan is workload. It is a 3.2. There is a current staffing plan based on the workload and statistics. pharmaceutical care is not working alone. Should be there is a coordination with the quality department. They have a hospital staffing plan. Based on the hospital staffing plan equations, they will be prepare their own staffing plan based on the equation already selected by the hospital staffing plan. Here we'll be looking for document evidence. That means it's not a policy, but like a staffing plan. In our hospital we prepare like equations, and based on these equations, and we did our workload, and according to our workload we put it the type of the position need, for example, clinical pharmacy, pharmacist, and technicians also. And what is our budgeting, what already approved from Ministry of Health, and we went to what is current we have, and also what our plan, and here also we have another standard talking about should be has qualifications. It means not only a clinical pharmacy. What means of a clinical pharmacy? They have residency or they have master's degree in a clinical pharmacy. Pharmacist, what means a pharmacist? Means have a bachelor's degree from any university inside or outside of the kingdom. Technician, that means diploma after secondary school, 3 years or 2 years. What qualification need and categories of this qualification based on the also numbers and approved from the human resource chief. Also in 3.3 they are talking about competency assessment. Every member in the pharmacy, you should after the orientations, general orientation from hospital, and a second one will be departmental orientation, and third one will go to the job specific orientation. We have here to talk about competencies. In case of this pharmacist, you will work in the TPN, total parenteral nutrition, or IFN mixtures, or unit dose supervisor, or whatever there should be, it has a competency test. Competency, like assessment, like a check of the competency check sheet. You show them in case if he has, he's able to do this, all this process, they will be accepted to work in this place. Or you can give him further training and education. Here, 3.4, we're talking about quality coordinator. Also, we're looking for his personal file. He to looking for any quality training certificate. At least he has, for example, in case if he has CBAHI certified professional healthcare quality, or he has Six Sigma certification, or he has any attendance of course, or diploma of quality, or any attendance course related to quality and tools and improvement methodology. What certificate had with his experience, he will be evaluated based on that. There is a structured orientation program, as I told you, orientation program at pre-pharmaceutical care relevant aspect. Here also he was looking to looking for 3 orientation program, three orientation. The first one I'm talking about general orientation. Second one will be departmental orientation, and third one will be job specific orientation. And he was looking for the orientation checklist. 3.6, there is a process for ensure that the new employee competency is evaluated before allowed to work. Here, he was looking for the date of the competencies and the competency, and also the orientations date and his joining date to the pharmacy department. And for example, in case if you joined this month and you put in your policies or programs of orientation, you said after 1 week he will complete his departmental orientation. He will look for his signatures the staff or his signatures in that and date and time. It's very important to be very clear for even certifier, because he's talking about before allow him to work independently. He was looking for personal file, pharmacy staff competency assessment, date and sign, and he will look for his joining date to the pharmacy. There are to continuity professional development activities for all pharmacist care staff. Document evidence and related to the continuous education program. The certifier here, he was looking for the continuous education programs. He wanted to see the programs as a table, for example, and in case if you finish some program of education like lectures or workshop, he wanted to see the attendance of the staff this program. Medication management number 4, the pharmaceutical care and medication used in the hospital are well planned and comply with law and regulation of relevant authorities and the Saudi Food and Drug authorities. Here the certifier will looking for the organization and management of the medication throughout the hospital, procurement, storage, prescribing, preparation, dispensing, and nursing. We're looking here for the plan, medication plan. And you were looking for the plan, as I told you, document review, that means plan or guideline or policies or any protocol. They say here multidisciplinary medication management plan or policy. Please be careful when we say multidisciplinary. I cannot accept a plan signed only from pharmacist department and for example, medical director and approved from hospital. In case of no nursing there, they will be give you in this 4.10. Or in case of some of caregiver is not involved in that process, that means will be affect your scoring. Policies and procedure are developed in collaboratively with relevant staff such as medical, nursing, and management staff. See here, even management you will be with you in the signatures. Please be careful when you are preparing your plan. It means management here, they will be involved the medical supply directors, for example, and for example, store keepers or medical store keepers or anyone who is involved in medications, whatever medical supplies or from nursing side, from physicians, and from in case of purchase department already involved in your process, you should let him to be signed with you in this plan or policies. Be careful when we're talking about multidisciplinary medication management. A certifier who was looking for the signatory papers and he was looking for the people by department who was involved in this process. Updating policies and procedure manually is readily accessible to all healthcare professionals involved in the medical education. If I'm talking here about manual, okay, in leadership also chapter talking about manual. That means every department in the hospital should have manual. Manual, he has a lot of manual should have organizational chart of the pharmacy. He has a hospital organizational chart also. The job descriptions of all the categories in the pharmacy, like pharmacy, clinical pharmacy, technician also. Without name, only give me the job description of them. And also I need to looking for the scope of service and staffing plan and policies or departmental policies and hospital-wide policies should be involved in that manual, and also the format. All the format used in the pharmacy care should be involved in this manual. Here, if you're looking here, staff interview, that means he will ask, the certifier, he will ask the staff about the manual and accessibility of this manual. Is it accessible or not? That means he will ask about some policies or asking about, he will ask some questions, and from the answering of the pharmacist or pharmacy technician or clinical pharmacy, he will ask him from where, based on what he said, based on our policies, where your policies? He said in our manual, where is your manual? And he will look at further questions about, is this manual accessible to all staff? Be careful when we are talking about these issues, because we are talking about manual should be accessible and all staff aware about. Appropriate source of drug information are readily available in healthcare professional involved in medication. Here will staff interview also. The certifier here, he will ask about some things related to any medications, and he will looking for you how you can get the information. In case if you wrote in your policies and you have a book or manual or CD or DVD online, subscription, drug information resources, information, drug information, book or whatever, you wrote it and what is your profile, he will ask the pharmacist or anyone inside the pharmacy, especially the OPD pharmacy, and he will ask in case of this dose like this or in case of this medication as prescribed together with other medications. Is accepted or not? He said no, based on what, based on our reference, how we can get your information. From this, he wanted to looking for one pharmacist or one pharmacist inside. How can he get his information related to the medications? 4.5 pharmaceutical care services are provided 24 hours. This should be clear, and you need document evidence to put it. For example, an inpatient pharmacy, you put it one side signed and say 24 hour but in case of not, you should put on call systems like pharmacists on call whenever the inpatient pharmacy is closed. About ER, it should be 24 hours. Medication management 5, the hospital has a system for a safety of high health medication, and this is very, very important standard, and I think every hospital he go through this preparation for this standard. Talking about health medications, I will told you one thing. Whatever there in substandard 1 and 2, we are talking about should be you have a policies, and this policy should be multidisciplinary policies or plan, and you should have also a list of this high level medications and based on the evidence-based practice, and this is a substandard talking about 0.5 to 0.4, 0.5. This should be available in this list. And also, you should have how you are managing this, and how you are dispensing, and how you are prescribing, and how you are introduced to when you give to the patient. Will be. See the certifier here. He saw the policies as a document review, and he saw the list as a document evidence. And also inside the policies, we saw how you are dealing with this, like you are using auxiliary labels, standardization of ordering, transcribing, preparation, dispensing, administrations, double check. He wanted to see this all 5 to 5, 3.5, all this available in your policy. But also, he will not looking for policy only. He will looking for the implementation. In case of you asking the nursing, when you are, he will give you. He will do it like a scenario. For example, he will ask, in case if you are a doctor ordering potassium chloride, and how can you administer this medication? Okay, if you receive it from pharmacy, and how you can keep it and storage, and how you are administered to patients. He wanted to hear from nursing she receive it as a high-risk medication, and he will have auxiliary labeling, for example, like some hospital put it high-risk medication, أدوية عالية الخطورة, by red labeled, and he will keep it in secure place or cabinet, and when he dispenses to the patient, should be two register nurse sign and saying looking for this process, and they have to double check and sign it together. This is all he wanted to looking for it when he go upstairs and he will meet the nursing there. Also, he wants to see here 5.4 about implementing standard concentration for all medication administered by intravenous infusions. Here, if you're looking here, he will start interview and document evidence. Document evidence, he wants to see the list of all intravenous infusions medications, and this about how they are standardization of the concentration for all medications. And this also, the tables should be staff awareness about this, and should be this list available in the medication rooms, and all nurses are aware about it. Medication management number 6. Also, this is ASR, essential safety requirement, and this is ESR standards. And talking about LASA, look-alike, sound-alike. Here also same what we prepare for high-level medication. Also we will prepare for look-alike, sound-alike. And for example, we need a policies, and this policy is multidisciplinary policies to show us how can we deal with this look-alike and sound-alike. And we will go also to list. We should have a list, and this list approved from the pharmaceutical BT committee, pharmaceutical therapeutic committee, pharmacy and therapeutic committee should be approved. This list. Also, the list of the high-risk medication should be also approved from that committee. The hospital taken actions in case of that to prevent the error, like for example providing the education. You wanted to see one of if your plan for education plan related to LASA, and also both and how can you both brand and generic names of prescribing LASA. Writing diagnosis in case you are using HIS. Health information systems, how you are dealing with that one. Changing the appearance. And for example, you added some auxiliary labels, like you put yellow labels, and you say this is look-alike, sound-alike. And show at least when we are dispensing this medication, or also in the if you have electronic system, they will be using some changing the appearance. Reading carefully. He wanted to looking for this one inside your policies. Here should be in verbal and telephone order. This will be medication management standard number 23. When you are using this one verbal and telephone order, at least we'll try to minimize as much as possible. In case you said this is prohibited, we cannot use. In case not, at least you say we minimize as much as possible. About also in case if you are before you are dispensing, in case of this LASA, you should be careful. Also, when you are storage, sometimes you when you are storage, for example, in case of the same medications, and you want to storage in same places, you should make separation. For example, first of the shelf, this is the same medication, but this is 15 milligrams, and the end of the last shelf, and the shelf will be a same medication and but 500 milligram. Also to minimize the medication error may will happen during the dispensing. Number 7, the hospital establishes a multidisciplinary pharmacy and therapeutic committee or equivalent. This is here about pharmacy and therapeutic committee. You should have a committee, and this committee is a multidisciplinary committee. That means you need to looking for physician is there, pharmacist is there, nursing is there, quality is there, and for example, dietitian is there. What already the members should be available and involved in the process. You should add him to the team. Look here for about, there are a term of reference. That means every the committee has a term of reference, and term of reference include the functions and membership, quorum, frequency, meeting, approval, and distribution of the minutes. I think if you go to the quality department in every hospital, almost the committees from their responsibilities, and they will put it a term of reference based on the requirement by standards and quorums, for example, when the meeting monthly or every 2 months, every 3 months, at least quarterly. And also talking about quorum, for example, 50% of the member, if attend, they will be conduct our meeting, and less than 50% they will be, or 70, whatever you put in your term of reference, they will be accepted, but don't make it more tight. Make it very easy. At least 50% of the members can be dealing with or conducting. Pharmacy Therapeutic Committee meet on the regular basis, at least quarterly. In case if you are a small hospital, no need to make meeting every month, because maybe you don't have any agenda related to that. You can say this meeting will be every 3 months, at least quarterly. But you can do it monthly in case you have a big hospital. Our hospital, we are doing it monthly, but maybe some hospital, small hospital, they no need to make a meeting every month. The meeting minutes of the committees reflecting the members' attendance. And here, very important, during the survey, they have 1 hour meeting with the survey, with the members. Member of the committee, they will be sit with the pharmacy survey, or medication management survey. And during this, he will be looking for the attendance and the members, and he will measuring all involvement of the members, and he will looking for the function. See here, number 7.5, the function of pharmacy therapeutic should be looking about this function should be served in the. He will looking for from 1 to 13. All this 13 functions should be in term of reference. In case if one of them is not there, they will be, say, if less than 80%, they will be, maybe will be give you partial. But if the surveyor he look for from 1 to 13, this function is available in term of reference. That means according to the pharmacy. But he will ask questions for all this 13 function. If one, he will ask a question, and he will see your implementation or only the function of the committee is working well or not. And be careful. Some people or some hospital, they will prepare minutes, and they are not disseminate the minutes to all members, and maybe the member, they are not reading the minutes well, and sometimes he's not involved in the process, involved in the meeting, or he didn't attend the meeting, and maybe the surveyor will ask him questions related, for example, did you approve all pharmacists' policies? And may you said no, or did you involve in the preparation of the substitution in case of the medication not available? And maybe you said no, and he will ask, did you see the drug formulary? And you review together, and in the meeting at some time the answer will, from the answer of the members, they will see the function of the committees working well on that. This is very important standard, and I hope all of you will work in it very well. Medication management number 8, hospital has update, structured and well-organized drug formulary. Hospital has a structured and well-organized formulary as updated annually. This is document review. That means he will looking for the formulary, is it there or not. In case it's there, okay, he will give you. But not only, see down 8.2, the healthcare professional involved in prescribing, ordering, dispensing, and dispensing patient develop evaluation and this formulary. That means sometimes the pharmacy therapeutic committees is responsible to develop this formulary. In case if you drink other or invite person, you can involve them in this committees, in this as a member in that preparation of the formulary. Formulary is not your hospital formulary. Don't depend on the Ministry of Health formulary, because Ministry of Health formulary is not accepted. Only a drug and generic and trade name, and this is not a formulary. Formulary should be have all what related to drug, trade name, generic name, and indications, and also the substitution and categories of drug interactions, and also the pregnancies or lactation status. The hospital formulary is accessible to all those involved in medication management. He will ask staff, pharmacy, and he will ask staff in nursing, and he will ask the physicians during the round, and he will say how they are in case of his medication. He will know is available in formulary. The question will not be direct. Please be careful. Sometimes he will ask something. He wants your answer to be say, I will go back to my formulary, hospital formulary, medication formulary, for example, drug formulary. You want to hear this answer. And in case he said, I'll go back to drug formulary, where is it? He will go, for example, in nursing stations or the medication rooms, or sometimes some hospital will put it online, an intranet. Our hospital will put it online, an intranet. They can, everyone in the hospital can access it, and you can looking for the medication by doing search, and you will directly see this medication. The hospital formulary is prepared by index. Also, he will looking for the index, and he will looking also for all indications, as I told you in the beginning. The hospital formulary provide guidance of antibiotic also as a brief. The hospital formulary provide list of approval prescribing abbreviations. Also inside the list will be abbreviation and prohibited abbreviations. List of prohibited prescribing abbreviation. The hospital formulary provide appendix, important policies in case. That means all from 8 to 8.9 should be available available in my drug formulary. Medication management number 9, the hospital has a system for requirement of medication that are not on the hospital formulary. And in this standard, we are looking for the medication what already not in my formulary. Not means Ministry of Health formulary. I'm talking about your hospital formulary. We have two type of that. Sometimes you want to add it one medication to the formulary, and sometimes is one for one patient's needs. There is a policy procedure. You need a policy procedure for selection and approval of recorded non-formulary with an unacceptable time frame. This is also, you put a time frame is very good for that one. A patient-specific non-formulary drug requesting. That means you have one drug you want to add to the formulary, based on some approved from BT committee, Pharmacy and Therapeutic Committee. And also in case one patient needs one drug, but this drug is not in your formulary, how you can deal with it? You can deal with that one, and you put a time frame for that. He said within 3 days, for example. Don't tight time for you. Some hospital write within 24 hours. If you said within 24 hours and the surveyor, he will go up and he will looking for that in the open, and you will ask the nurse, you request today, and this drug is not in your formulary, hospital formulary, and the hospital provide this medication after 48 hours. That means this will be affect your score. Write what you can do according to your practice. Also here talking about how you are handling non-formulary drug and requisition with accessible time frame. See here, time frame has become 2 times. That means time frame is very important. Because sometimes non-formulary should be passed through the pharmacy and therapeutic committee. Talking about also regular review of non-formulary drug requests by pharmacy therapeutic committee, you need to looking for 2 forms here. How you are implement this standard number 9, you need a policies, and after the policies you have 2 forms. 1 form in case if you wanted to add a non-formulary drug in general, as a general, and other form for specific for one patient, because for any reason for that you want to add this one only for that patient. That means you should have policies and 2 forms. 1 form for adding to non-formulary drug, and other one non-formulary drug but for specific patients. Number 10, the hospital has a system for handling out of stock, shortage, and disaster need medication. Here we are looking in case of any medication outage of prescribed and not available, and how can you deal with it? You need here a policies, written here a policies for out of stock storage and during the disaster medication management. You need here clear policies how you can deal with in case of emergency or in case this medication unavailable. In case of not emergency, how you deal with it, what time frame you put for yourself, 30 days, 3 days, or 2 days, or 1 day. In case of emergency, how many time frame you give yourself to bring this medication. Here, as I told you, when we are looking for, when you're talking about pharmacy and therapeutic committee, develops and approves medical substitution protocol. You need a protocol, clear protocol and list in the event of medication shortage or in case of any emergency and medication is not available, what are the substitutions? You need a protocol, a list also of all medication you have and what is the substitutions. It's very clear and approved from the pharmacy and therapeutic committees. There is implementation of the hospital approved medication substitutions. Here, looking here, staff interview means staff interview. You will ask the staff, and he will say, in case of this medication not available, well, what you will do. She will say, for example, I will go to the other pharmacy. Means pharmacy will go to the other one, and you communicate with the doctor or physician, or he will ask the physician, in case if this is out of stock, how can you deal with it? It should be very clear and list is available and staff aware about it. Here he looking for about emergency preparedness to respond to the social and lab demand of medication during the internal and external disaster. Here he need to looking for a plan, a clear plan for disasters and what the pharmacy involved in that, and all the people sign with you in that. And in case you have something like a crash card, for example, أو عربة الأدوية الخاصة في عملية الديزاستر، سواء ديزاستر داخلية أو خارجية، الكارثة، وكيفية التعامل مع المستودعات وكيفية التعامل الخط الساخن. ولابد أن تكون هذه الخطة عاملين لها تيستنج، يعني عاملين لها دريل، والدريل أنا عاملين لها evaluations، والevaluations they give an action plan based on their finding. مهمة جدا اللي هو 10.4 إنه يكون عندك خطة للكوارث، مشاركة الصيدلية في هذه الخطة، كيفية استعداد الخطة الصيدلية مع المستودعات الرئيسية، كيف الانفورمنت اللي صاير، وكيف طريقة اللي هو التحضير، كيف إنه عملت بالخطة هذه دريل سواء مرة في السنة أو مرتين، بس تكون هذه واضحة والستاف aware about it. Medication management number 11. The hospital has a safe and secure system for storage and regular medication and nutrition products in storage, pharmacy and patient care area. محتاجين policies how they are stored, medication and medical samples, free medical samples, and nutrition product should be clear in your policies. وهنا لابد يكون من المستودعات من استقبال الدواء. احنا نتكلم عن medication management، ما نتكلم عن pharmacy. That means from when we receive the medication from storage till a patient receives this medication. We want to look in here for the policies. 11.1, 11.2, the policy procedure control access pharmaceutical and non-pharmaceutical care staff, storage, pharmacy and patient care area, including after hours and the case of emergency client. And كل the procedure and policies very clear. And in case of after the medical supplies is closed, how can we deal with that policies? What's the on-call person we can communicate with him? There is a measure in place to secure the medication storage area, including limited access. في 11.3 هي بيشوف هي عملية الصيدلية وعملية المستودعات كيفية طريقة الإقفال، يعني عن طريق البصمة أو عن طريق الديجيتال نمبرز، اللي هو من اللي لهم حقية في الدخول ومن اللي لهم حقية في الخروج، قصدي في الأكسس. يعني هذه مهمة، هذه راح تكون عن طريق اللي راح أعطوها الأوبزرفيشن، يعني منها عن طريق الملاحظة، بيشوف مداخل الصيدلية ومداخل المستودعات تكون مقفلة بطريقة جيدة، وإنه ما فقط المصرح لهم بالدخول هم المسؤولين عن ذلك. We talk about observations, and we talk only authorized person has access، اللي لهم الصيدلية صيادلة ومن المستودعات هم اللي لهم الحقية. They will do an interview, for example. Please be careful when they are doing interview. Should be all staff aware who's access, who's have authority to go inside the pharmacy, who's not allow him to go inside. Based on that, will ask about also the portal, for example, or the cleaners. And be careful about it. Medication are stored away, avoid maximum with label showing drug names and expiry date. And label, he was looking for the label and expiry date. It's very also important. Down in the store and also in the pharmacy department. Number 11.6 talking about no medication will be direct storage in that floor, and also should be not also they will go not اللي ماسل السقف برضه 45 سنتي، ومن 10 ل 15 سنتي فوق الأرضية. وفي برضه من ناحية السيفتي يقولون برضه يكون في 5 سنتي بينك وبين الجدار حتى ما يصير في بعض المناطق اللي يكون فيها رطوبة، وبعض المناطق قرب من الجدار يسبب رطوبة. فهذه راح تكون عن طريق الأوبزرفيشن. معناته السرفاير إذا زار المستودعات أو زار الصيدلية راح يلاحظ عملية الليبلينج وعملية الإكسبايري وعملية الستورج، إنه هل في دايركت ستورج على الأرضية أو لا. Medication stored according to the manufacturer recommendations برضه عشان موضوع الهيوميديتي والتمبريتشر واللايت should be clear. هنا بتأكد من موضوع التمبريتشرز وأتليست إنه يعمل قياس للتمبريتشرز ما بين 18 إلى 25. room air temperature will be documented at least once daily. يعني the room temperature should be measured every day at least once. In case of he wanna looking for the sheet, and sheet is put it in one sometimes hanging in the wall, or you can put it in the one side, and all the people they know about this log sheet. And he was looking for the freezers and the refrigerator also. Temperature record kept in at least 3 years. In case of your hospital are re-accredited, he was looking for to know he looking for 1 year's back about all your papers for this log sheet. You should keep this log sheet with you. But here in the standard, say at least 3 years. That means be careful when you certify. He has authority to ask for you for last year and 2 years back. Also, antiseptic and disinfectant medication for external use, storage separated from internal and injectable medication. Also, here will be seen during the storage. FIFO is very important. First expiry, first out. And this is principle. He wanted to looking for it. Maybe he will be pick one medication from shelf, and he will looking for the expiry, and he will go to the back of the same medication, and he will looking for the expiry date also. In case if that was in the back as a new expiry or old expiry, it will be near to expiry. They will ask you are not implementing FIFO principles. Please be careful also when you are making this storage area and prepare your storage. Don't say, I'm not talking about pharmacy here, I'm talking about medication inside the ward, medication inside the medical supply department, and medication inside the pharmacy. In case of pharmacy, excellent, but when I go to the medical supplies or medication storage and medical supply, is not following my process of procedures, and they went up to the nursing, and they didn't follow my procedures. That means 2 out of 3 they're not following the procedure. They will certify or they will give to you. Be careful. In case 2 out of 3 they will give 1. In case 3 out of 3 they will give 2. Be careful when you are make around and looking for that. All medication storage area inspected at least monthly by pharmaceutical care according to the hospital policies. اللي هو يسمونها التشيك الصيدلية أو pharmacy checking every month. اللي هي crash car مع all medication area in case storage medication storage store or medication rooms inside the units. And he needs to looking for the evidence, document evidence. That means you have the monthly check list from pharmacy and sign from pharmacies who already did the inspections. And clearly, in case of any expired medication or damaged medications, should be clearly labeled and separate from other drugs until they're removed or proper destruction. See here, in case if he went there and to the store or he went to the pharmacy and he found some medication already expired, should be separated and out in their expired medication. It's very clear and labeled for everyone. Medication quality issues reported. So this is here, he was asking about any reporting you did it during last years or during the last 3 months for FDA, Saudi FDA. Number 12, the hospital has a safe and secure system for storage, refrigerator, frozen. Almost the same what I'm talking about. They need to hear about policies, and he needs to hear about what this refrigerator, frozen, and biologic and vaccines. He wanted to see the refrigerators is there or not, and he was looking for about refrigerator, frozen, quote appropriate to thermometers, and he will see this thermometer, and he was looking for also the checked and documented daily refrigerator temperatures, and also the frozen should be like this. But I think we don't have any freezers temperatures, only inside. But I think no medication could be kept there. May some hospital they have, but be careful. And all vaccine refrigerators are connected to the very important substandard 12.7. Should be all refrigerators are connected to emergency power. AMP, some hospital labeled by this. He will, so far clearly he will go to this refrigerator and he will go back and he will see that you're connected, اللي هو توصيلة الثلاجة في الكهرباء تكون موصلة في فيش اللي هو اللي طبعا مربوط بالمولد الكهربائي emergency power. فإذا كان مش مربوط تاخذ زيرو. be careful. مش نتكلم عن الصيدلية، أي ثلاجة موجود فيها دواء سواء في الصيدلية سواء في أي مكان آخر. فنتكلم عن هنا عن medication management. And if you're looking here by observation, the vaccine refrigerator temperature is constantly recorded, or temperature record kept at least 3 years. Same what we talk about in medication management standard number 11. Here he wants here also in your policy, as I told you in the beginning, how you can deal, and he will make a staff interview. In case if you came here and you see the refrigerator is out of range, means 10 or 9, what you will do? Staff should be aware, and how can we deal? For example, she immediately will remove the medication and will keep it to another refrigerator, and they will be asked maintenance department to come to repair this refrigerator. Staff interview, that means he will ask questions related to that. Should be all staff, or at least the supervisor who is responsible about this pharmacy should be aware about it. Regarding to the food, drink, biological samples, and cultured media should not be inside any medication refrigerator. This is if he will open the refrigerator. If in case he found any food inside this refrigerator, they will not. He will give you here 0 related to either 12.11. Please be careful, and should be according to your process, according to your procedure, and according to the standard. Not allow for any food or drinks, biological sample, and cultured media should be not in that. Medication management number 13. The hospital has a safe and secure system for all storage and safe management of hazardous medical and pharmaceutical care. Here he wants to be a written policies, how you handling this, and also he wants a list of this hazardous and using the MSDS, and should be all the hazardous materials clear and labeled. And this is by list. Hazardous material pharmaceutical chemical storage in the 13.3 separately low shelf. We want to looking for that. Let's keep it in one shelf. Flammable and volatile substances and storage and the prepared safe cabinets. And spill kits and personal protection equipment are readily available. Number 13, standard number 13, you want to looking for this chemicals and hazardous materials should be separated, storage in a separate cabinet, and you are looking for a spill kit, chemical spill or biological, mainly talking about chemical spill kits should be available, and personal protective equipment, and the PPE should be readily available in the pharmacy. And for staff involvement, and you should also pregnant and should be clear in your process how they will deal and what structures you will do in case she's dealing with this or she's exposure to risk, and what are alternatives work assignment in case of this will be in case she has a pregnant woman and she or pharmacists and she wants to go. If you're dealing with this one, what's the substitutions? That means you will transfer her to other units or another department or another. I mean, I'm not talking about other places to work. And material also MSDS, your material safety data sheet. All these items or substances, put the names, and according to the manufacturers, how can you deal with it in case of happen something. This is very important, and by observation, the certifier will look for it. Also here in the number 813, eye wash stations and emergency water shower are available, whereas hazardous medication and pharmaceutical chemical are available. For a certifier, he will look for eye wash. In case if you didn't have eye wash in pharmacy and near to this medications or hazardous medication, pharmaceutical chemical, they will give you 0. In case if you have this eye wash, he will be opened and he will look, it's working or not. These sometimes it would be more slow and it's not working well. It should be more يعني بعضها تكون ضعيفة الموية حقها، الرش حقها يكون ضعيف، فتأكدوا منها تكون جيدة وتعمل بشكل جيد. The hospital staff we educated. The hospital staff are well educated on the proper storage and handling of hazardous medication. You need to look for from your education plan or education. You want to look for one from safety officer in hospital. He gives lectures about hazardous material and MSDS and how to deal with them. And this is very, very, very important. He will also looking for the attendance, and he will looking sometimes not only safety officer they will do that one. Sometimes infection control they will do related to spill kit or chemical spill kit. Number 14, the hospital has a system for ensuring stabilities of medication available in multi-dose containers. Here, they are looking for all medications. He added here, if you're looking, they have some additionals. Before, it's not only about syrup and vials and multi-dose vials and vaccines, for example, any liquid, but they added now also the drops and cream and ointment, nebulizer solutions. This is by document evidence. They have one list of all items based on your evidence-based practice or evidence reference. Whatever you put there, you should assign and approve by Pharmacy Therapeutic Committee after you sign and distribute it to all units, and should be all units aware about it. In case if they are opening eye drops, should be written their opening date and expiry date based on that tables or that's approved list of these medications. In case of the syrups, in case of the antibiotic, in case of the creams, or in case of any multi-dose vials, should be written their open date and expiry date. This by document review, and also 14.2, he wants to see by observation. When you want to visit the units, he will look for that this medication already written there, opening date and and expiry date. And also staff, they are aware about where is the list in the units. For example, he asking, depending on what you write here, opening date 25 2017 and expiry date 25 or 24 of the 3 2017. Based on what she said, at least she will answer, or he will answer based on the approved list what already provided from pharmacy department. Number 15, the hospital has a system for for ensuring accessibility, available monitoring, and security of emergency medications. This is talking mainly about crash card, accessible, available monitoring, and the security of emergency medication. Mainly, we are talking about crash card based on the current Saudi Heart Association recommendations. Emergency medication are available in the patient care unit. Every unit they have a crash card. And the emergency medication crash card and emergency medical badge are protected from loss. That means they have secure, actually it's secure. Emergency medication crash card and emergency medication in the crash card and emergency medication bag are protected. That means as they have secures and observed by emergency medication bag are protected from loss and chips using the safety plastic seal. That means they have اللي هو القفل البلاستيكي. وهذا راح هنا بركز على حاجه معينه. بعض السيرفاير راح يسال النيرسينج they will ask her you open the crash card. She should say I will not open because only we are open it in the in emergency situations or during the monthly inspection from pharmacy and checking. فحبيت اني اتكلم عن موضوع انه موضوع اللي هو الكراش كارد انه ما تفتحها الا بامر من الصيدليه ولا تقبل الامر من يكون من السيرفاير، تكون الامر يكون من الصيدليه in case of the السيرفاير need to look for the standardization of the crash card. بلاستيك سيل هذا اللي تقول انه برضه الكراش كارد لها اكثر من تشيك كل انها تشيك يعني تشيكي بعد الامرجنسي بعد ما يعملوا لها ريفيل وبعد كل مانث الصيدليه بتعملها تشيك. برضه في تشيك الان الكراش كارد از هول كل شيفت في هاند اوفر بتوين the nursing and they have sheet or the book sheet for that one. Number 16, the hospital has a safe and secure system for managing medication in the patient care area. Implement multidisciplinary process, procedure, medication assignment, floor stock. Here we are talking about floor stock and how they are dealing with the floor stock in case document review. That means looking for the policies and observation. They were looking for the floor stock inside every unit. Important here, looking for 16.2 anesthesia refers agent. That means he will go to the OR. Mainly, he will go there. You want to see the list in case of antidote, in case of this medication and overdose, and what is the antidote for this anesthesia agent. Be careful and should be staff aware about it. And it's available in recovery rooms inside the OR. The list is there, and medication of the antidote medication available there, or referral agents is there inside this. And also he will go to the OB-GYN, and he will looking for the oxytocin are available in the labor and delivery units. And also benzodiazepine available everywhere. This is narcotic medication should be available in all units. That means be careful to in the floor stock to put it benzodiazepine in every unit and oxytocin and OB-GYN, for example, and referral agents from anesthesia, physiologist, anesthesia should be referral agent available in the recovery unit. All medication in the patient care area are well separated, properly labeled, and this is also looking inside the floor stock should be labeled and expiry, like what I told you in the storage of medication should be also same procedures available there. And electrolyte, concentrated electrolyte like potassium chloride should be removed from all units except unless patient safe necessity, for example, in case if you put it in yourself, critical care units should be there. in case the certifier he found potassium chloride in the floor stock of the internal medicine or male medical or surgical department, or male surgical, for example, or pediatric, he will be remarked as this is not, they are not following your policies. Number 17 is the system for identify all medication brought into the hospital by patients and family. You should have a policies and multidisciplinary policies. That means in case of this patient admitted to the hospital and he has his own medications, you should clear your policies, inform that people, members, staff, nursing. He will ask nursing in case if the patient brought his medication, what you will deal with it. In our hospital, we are dealing this patient in case his family is there and medication available from the hospital formulary. We will give back to his family and we will dispense from our own medications. In case if this medication is not from our own formulary and the patient need to use, should be sent it back to the pharmacy and we put it one cabinet or one drawer or one shelf there for patients' own medications, and we will dispense from them. And when discharged, we will give them back to the patient. Here, he will ask him pharmacy staff, and he will ask him also the nursing staff in the units. Please, you should inform him about your policies, and it should be very clear and documented also in medical record of the patient. Number 18, there is a system for storing narcotic. Here, I will not talk more about 18 because 18 we should here following the FDA, Saudi Food and the FDA, and also we will follow the rules of the ministry about narcotic, about storage, about securing, about inside the units, and about in case if you dispense and the remaining things and what signing a format, all related to that one. I think it's so clear to everyone, should be followed according to this FDA or Saudi law and regulations, Ministry of Health. Number 19, the hospital has identified qualified healthcare professional permitted. This is here we're talking about privilege. هنا بالنسبة للميديكيشن مانجمنت اللي هو 19 راح نتكلم عن بس اللي هو البريفليج. You should have a policies and you should have a list of who's privileged to prescribe this medication, who's not privileged, like consultants, specialists, and residents. I will not go through it, but it's very clear, and they will open medical record and they will go to the staff interview. Number 20, talking about ordering, transcribe. This is the plan for how you are dispensing, ordering, transcribing medication, ordering guided by clear policies and procedures. He will almost, you see here, open medical record review. That means he will go to any open medical record. Number 21, talking about prescribing, ordering, same, but this is specific type of medication. Here, you're looking for example, BRN and automatic stop order should be definitions clear. That means one policy should be covered 20 and 21 because will be more clear, and also here blanket and order in case of the patient need to do surgery. Don't say, they will say same his medication. You should reorder again after his surgery because the condition of the patient is different than before he's doing the surgery. Number 22, this is the last one. The hospital has a system for prescribing antibiotic. He needs here a guideline, and he needs the implementation of the guideline by using and approved from Pharmacy Therapeutic Committee, and implementation of the guideline by medical record. Means implementation, he will go to any RTA patient or any infectious disease or any patient he has infectious, and he will see the empirical therapy used. This empirical therapy based on his hospital guideline or not. So looking for the implementation of this guideline. I'm sorry يعني أنا أعتذر منكم إني طولت عليكم كثير، ولكن أخذنا وقت، وإن شاء الله نكمل في الاجتماع إن شاء الله اللقاء القادم إن شاء الله، وراح نكملها لحد الستاندر نمبر 41.
دكتور عايد، شكرا لحضرتك جدا، سعدنا بيك معانا. ربنا يبارك في حضرتك يا رب، ما شاء الله ما شاء الله، يعني الستاندرز وقوتها، ربنا يبارك فيك يا رب، وفي انتظار الجزء الثاني ان شاء الله باذن الله المره القادمه.
اوكي، اول شيء احب اني اجي اشكركم على حضوركم كلكم. دكتور عايد شكرا لك على المحاضره. يعني ماخذينك احنا الشهر كله كامل، الاسبوع هذا ان شاء الله بعد اسبوعين. نشكر جميع اللي هو الحضور الليله، يعني اسعدتونا وشرفتونا بحضوركم، وان شاء الله احنا بالخدمه اللي هو مهنه الصيدله، وان شاء الله لتطوير اللي هو مهنه الصيدله، وكل شيء اللي هو فيه خدمه وفيه علم اللي هو للصيادله ان شاء الله. نستأذنكم، الله يعطيكم هذا العافيه. شكرا اللي هو جزيلا للدكتوره رشا وعلى التنظيم. اوكي، والشكر برضو موصول لاخوي فواز الحربي، اوكي، هو اللي قائم على تنسيق هذه المحاضرات. يعطيكم الف عافيه. شكرا لك دكتور عايد، وتصبحون على خير.
FADIC. Revive your clinical career.